Monica McGee are our sign language interpreters. Behind the scenes, Jackie and Jasmine Mativier are our Spanish language interpreters. We invite members of the media to ask questions. If you can identify yourself and your organization, we would appreciate that, and we'll take the first one.
Our first question is from Frances Weller with WECT.
Hi, Governor Cooper. It's Frances Weller with WECT in Wilmington, and also greetings to Dr. Cohen. You know, as the push continues to get folks vaccinated, there are those who are simply not going to get the vaccine because, for various reasons, they don't want it. But we're hearing that some companies, such as restaurants, are now telling employees that they are required to get the vaccine. As governor and former attorney general, is that legal?
Well, first, we're recommending that all adults who are over the age of 18 for Moderna and Johnson & Johnson and over the age of 16 for Pfizer to get vaccinated unless there is some special medical issue that you have. It's really important to educate people about getting a vaccine. Yes, we have seen a lot of vaccine hesitancy out there, but at the same time, once people learn more about it, once people see community leaders, doctors that they trust, other people that they trust, tell them that this is safe, then more and more people are coming over. So we want to give as much time for that kind of education. We know that there are a lot of jobs out there that's going to be important for people to be vaccinated because they deal with the public. I know that we're going to be talking with legislators and others about whether vaccines should be required and whether employers can require vaccines. I don't want to get into interpreting the law here at the podium without giving a firm review of all of this. But suffice to say that we're going to be pushing for people to get this vaccine. We know that employees who particularly have to deal with the public need the vaccine to protect themselves and the public, and we're going to keep working with businesses and others to find the best way to do that. Would you want to contribute to that? Okay. Next question, please.
Our next question is from Caroline Hicks with WBTV.
Hi, this is Caroline Hicks with WBTV. Thank you for taking my question. I wanted to see if I could learn more about the vaccine supply and what you guys are expecting as a state as we move into April. We keep hearing the vaccine supply is going to go up. Do you know by how much? And do you know when that would allow the state to open up vaccinations to Group 5?
Well, first, we're continuing to be encouraged by what we are hearing from the President's administration. We are in constant contact with them. One of the things that we as governors ask the administration is for a better runway so that we can see what's coming down the line so that we can prepare. And we will be getting increases in the number of vaccinations, which has so far allowed us to open up groups earlier than we had expected, and we hope that continues to happen. But I'll let Dr. Cohen address that specifically.
Hi, Caroline. To build on what the governor was saying, so our vaccine supply has really steadily increased over the last 8 weeks. We were getting about 120,000 doses at the end of January, and going into this week, we're doing about twice that, so about 240,000 vaccines are coming into the state. But remember, that's just the state allocation. There are also additional channels that the federal government has added. For example, going to our retail pharmacy partners. So we know every Walgreens and some of our CVSs in the state of North Carolina have vaccine. That is above the allocation that comes to our state. We know vaccines coming to our FEMA site in Greensboro that was mentioned, for example. It's going to our FQHCs, or Federally Qualified Health Centers. So there is vaccine coming in a number of different channels. But in terms of what is coming to us, again, we have seen that doubling over the last 8 weeks in the Pfizer and Moderna. And it is really the Johnson & Johnson supply that is really going to pick up in the month of April. April that will, I think, allow us to further accelerate our efforts. Right now, we got a one-time allocation of Johnson & Johnson vaccines the very first week it was authorized. That was about 80,000 doses. We've gotten just a small amount, about 10,000 doses since then, but we have been forecasted by the federal government to be receiving more of that Johnson & Johnson vaccine end of March, beginning of April, and then every week going forward. So I think that will take us from about 240,000 into 350,000 range every week. So as the governor said, we hope to be able to continue to work through our eligibility groups and stay on track for President Biden's goal of having all adults be eligible by May 1st. Thank you.
Next question, please.
Our next question is from Richard Craver with the Winston-Salem Journal.
Hello, Governor. This is Richard Craver with the Winston-Salem Journal. I have a couple of questions, one of which I just wanted to make sure when you're talking about the members who will not be eligible for Group 4 until April 7th, are they still those essential workers who did not meet the criteria for being considered as frontline? And then the second question is, as we're seeing more vaccine coming in and we're seeing more vaccinations, how are you putting that into perspective when it comes to reopening the economy and including the reopening bills that are in the legislature?
For Group 4 on April 7th, more of the essential non-frontline workers will be eligible, but I'll let Dr. Cohen address that specifically. And we are very hopeful as we look toward the order that ends not this Friday, but next Friday. Our numbers continue to improve. We've said from the get-go that we're going to follow the science and the data. We have been by easing restrictions over the last couple of orders. We hope to do that again this time as we continue to see improvement in our numbers. And you know, more and more people are getting back out and doing things, and that's positive. It's positive for our economy. We just want people to make sure that they are careful and responsible to get vaccinated. The more people we get vaccinated, the better off we're going to be when it comes to looking at these numbers and preventing serious illness and death. And the more people who are careful, wear a mask, and do the things that they need to do, the better off we'll be. But I'll let Dr. Cohen address a little bit more about the Group 4 and what's coming up, and then that other issue if she wants.
Hi, Richard. So yes, starting today, those in Group 4 who have a medical condition, an underlying medical condition that puts them at higher risk for bad outcomes from COVID, are eligible for vaccine. And I read a long list. It's everything from diabetes and cancer, heart disease, lung disease, to obesity or smoking. So I would encourage folks who may have an underlying medical condition or may be obese, smoker, or other to really look at those conditions and see if they are eligible. We've talked throughout this year of COVID where we know that half of adults in North Carolina have a medical condition that might put them at higher risk for COVID. So we know this can be a large group. So we hope that folks will take advantage of the fact that they are now eligible for vaccine and go and get an appointment. On April the 7th, we'll move to the second part of Group 4, which includes additional frontline essential workers. These are potentially those in some of the industries that were already available, but they may be people who can work from home. They would become eligible, and other kinds of essential businesses. Again, you can go to yourshot.nc.gov. You can go through a number of questions, and that they will ask you about your employment, and that will funnel you into the right group to know whether or not you would qualify as the part of Group 4 or whether or not you would be in a Group 5. Thank you.
Next question, please.
Our next question is from Dawn Vaughn with the News and Observer.
Hi, Dawn Vaughn with the News and Observer. So it's been a year since North Carolina's been under the state of emergency, and as you mentioned, the current executive order expires next week. So what can you tell people now so they can make plans since Easter and Passover are coming up? about what kind of restrictions will be lifted next week, and also what the benchmark is if May 1st being open for vaccine eligibility, if that's tied to restrictions so people can make plans.
Well, thanks, Dawn. As we've said all along, that we look at a combination of data metrics to determine where to go with easing of restrictions. And as I mentioned earlier, we are very hopeful that in the next executive order that we could see additional easing of restrictions. I think the structure of how we have set out these restrictions have been positive for North Carolina. It has resulted in positive health results for our state. Our economy is continuing to grow and moving in the right direction. So we feel confident about where we are and look forward to announcing that next week to talk about what's going to happen on Friday. Next question, please.
We have a follow-up. Dawn Vaughn, News and Observer.
Thanks for the follow-up. And I know you just said next Friday, but people are asking ahead of time. It's a week and a half until Passover and Palm Sunday. Clergy are asking what to do as people are vaccinated. What can you tell them today instead of right as the order is expiring?
So as I mentioned earlier, we are hopeful that we can ease restrictions even further in the next executive order. We're going to continue to look at the data the rest of this week and through the weekend and the first of next week, then analyze all of that data and make decisions on what that needs to be in consultation with our health experts and in our continued conversations with businesses throughout North Carolina who have contributed greatly to the kinds of protocols that we have put in place.